Welcome to America's Heroes Group.
And America's Heroes Group, Roundtable with partner Veteran Healthcare Policy Institute, VHPI. Today is Saturday, February 19th, 2022, in case you didn't look at your calendar this morning. And February is Black History and American Heart Month. So make sure you take care of that heart. It doesn't stop. If it stops beating, so do you. So make sure you take care of that one heart you have. And our host is Cliff Kelley, of course, and I am his co-host, Colonel Dr. Damon Arnold. Our executive producer is Glenda Smith. Our digital media producer is the iconic Ivan Ortega from Scouts Honor Productions. And today we have two people on the phone that I have a really high regard for. Suzanne Gordon is the VHPI Senior Policy Analyst, and her work expands over decades reporting on healthcare programs, workers' issues, policy, and she has authored or edited 21 books. Suzanne has written two books in particular, The Battle for Veterans Healthcare and The Wounds of War. Make sure you take a look at those books. They are fantastic. And with her, we have Jasper Craven, the VHPI Interim Executive Director. Our today's discussion is going to center around the disparities of Black veterans' care in VA and healthcare in general. Hello, Suzanne and Jasper.
Hey, how's it going?
Good. So who wants to start off? Let's talk about this issue. This is something that we have been talked about a little bit in the past, but I know you're going to have a little bit of a focus on it today. But this disparities of Black veterans' care in the VA system and healthcare in general. What do you have? What's your perspective on it?
Jasper, yeah, sure. Well, yeah, I can give some of the history, and then Suzanne can follow up with some of the more recent encouraging data here. But you know, I mean, as we all know, the sort of founding pledge to America's veterans was made at the tail end of the Civil War by President Abraham Lincoln. He pledged to care for those who bore the battle and their families and their children. And out of that promise stemmed really one of the first social safety net programs, and truly revolutionary at the time. Black Civil War vets who had been critical, especially at the end of the war, in beating the Confederacy, they were brought in on these pension benefits. They also gained access to health care. So, in some ways, what was then the Veterans Bureau, sort of the precursor to the VA, was leading the charge progressively to offer equitable care and support to Black service members. However, in practice, over the last 250 years, there have been serious issues in the deliverance of those benefits. There was an interesting investigation shortly after World War II, actually, by Ebony Magazine, that showed that Black veterans in Mississippi were being frozen out of home loans, for instance. I think it was only around 5 or 10 home loans out of a few thousand in Mississippi were given to Black vets. And, some of those disparities have shown up more recently. Certainly it's been a lot harder for Black Vietnam vets to be given PTSD benefits. There have been issues around the GI Bill and other signature VA programs. Now, a lot of these issues sort of flared up during the Trump administration. There was also some pretty shocking examples of just all-out racism at the VA that the Trump administration permitted. There was a survey by the American Federation of Government Employees, which represents VA workers, in 2019, 76% of those respondents said that they'd witnessed or been, party to a racist event. And so the Biden administration made a lot of promises to change these issues. There's also an ongoing Government Accountability Office study to try to diagnose the problem better and fix it. But, there's also been some encouraging data recently, and also, in previous generations when it comes to caring for Black vets.
Oh, interesting. Very, that really sets a nice playing field. And I was thinking about when you were talking about that, the benefits to veterans for PTSD from the Vietnam era, and it started sparking some memories about, just in general healthcare. When we start looking at black maternal death rates in the country, so it appears that some of these implicit biases may be transferring over to our veteran population in a way of health care, because for African American women, when they go in childbirth, they have a higher rate, almost 3 times as high of demise of the child, and the mother during childbirth. And it's really related to how they're being perceived, whether they're being taken seriously about their levels of pain, and it's been shown that it's kind of an implicit bias that people of African American descent are stronger and they can take more pain, and so you don't really need to give them the pain medication. So multiple studies out there, and I think that actually does enter into the realm of how veterans are being treated, part of the VA, but it's a really a systemic medical system problem, but it should not be occurring with our veterans, right?
It shouldn't be occurring with anyone. And,
right.
I mean, I think the fact that, what's interesting to me is that, when it comes to all kinds of things that are tolerated in the broader population, like suicide is a huge problem everywhere, but, it's not a vets-only problem, but Congress seems only to care when it happens to veterans. I mean, it's just extraordinary. I mean, why do veterans get a national health system, which they're trying to kill, but the rest of Black Americans and every American doesn't get a decent health care system? I mean, I think that the issue of health equity, the VA certainly is embedded in a larger racist society and classist society, but I think that, ironically, the VA is a sort of a safety net healthcare system, and you can't get into the VA if you're not sick and or poor. There's no other healthcare system that cherry picks the sickest, poorest, oldest people in the country. And so, you have studies that have shown that the people who depend on the VA, there's 9 million enrollees. There probably could be about 11 million, and there's who are really eligible, but there are 9 million enrollees, and of those, 6 million depend on the VA for all their health care, and most of those 6 million are African American, people of color, women, and certainly low income. And I think that it's very interesting. People who are interested in this issue should look up in 2014, way before this issue became sort of, the issue of the day. The American Journal of Public Health did a whole entire special issue on the VA as the only healthcare system in America that is interested in health equity and racial disparities. It's a fascinating issue, and you have, a study that was done in 2020, I believe it was 21, where they showed that deaths among African Americans due to COVID were far fewer. There weren't the kind of healthcare disparities in deaths, not hospitalizations, but deaths due to COVID-19 among African Americans and people of color in the VA. And there was also another study. You find it probably more interesting, Damon, because you're a doctor and we're not. But apparently there are actually there are certain cardiac conditions where African Americans do better than Caucasians in the VA if they have access to care, which they do, obviously, in the VA. I want to point out that any facility closures that they're contemplating under, this new Air Commission, or any reductions in benefits that, the Republicans are clamoring for, would hit African American, people of color, LGBTQ, vets, much more than upper income white people.
Yeah, that's that's really interesting because when you were saying that, I was thinking about many of these people who are making these rules or these laws never served. You have very few in there. Particularly, I like Adam Kissinger because he actually served, and he really is trying to stick up for veterans benefits, and we have other people who are very supportive of veterans, but in general, for people to actually downplay the benefits for veterans after they've served. And here we go, we're looking at another war potentially starting overseas with the Ukraine. We're looking at, China threatening Taiwan, and you're going to need service members. And how can you ask people to serve if you can't take care of them?
Well, and I would respectfully beg to differ, with the idea that the problem is that you don't have enough people who served. Jasper and my husband Steve Early and I are coming out with a book in August about veterans, and we look at the so-called service candidates, and their record is terrible on the VA. The fact that you've served. There's lots of people in Congress who have been in the military and vote, against veterans. And this new book that was just launched, which is an attack. It's a guy who's now the commissioner of Department of Veteran Services in Virginia, and he's a vet. He's a combat wounded vet, and he's attacking the idea of giving benefits to veterans. Who he claims, unless you've got what he considers sort of a static condition, like an amputation. If you have PTSD, MST, all kinds of other problems, you somehow don't deserve benefits. So I don't think that the solution is to get more veterans in Congress. I think it's to get, it's to get the right kinds of veterans in Congress, or the right kind of people in Congress.
Right kind of people,
I have to tell you that having talked to vets, sometimes I think maybe you don't want vets to make policy around vets, because I have never seen a group of people who are so unsympathetic with each other. I talked to a Vietnam vet one time who said, I don't know, I don't want to sit around in some waiting room with all these Vietnam wannabes. And this guy was in Force Recon. He's a lovely man. He was in Force Recon. But he thinks that my friend, who used to live across the street from me when I lived in Massachusetts, who was never quote unquote in combat, he flew the C whatever they were, C-130. He flew those supply planes into the combat zone with the supplies and took out the dead and the wounded. And this guy has been sitting in a locked room since he came back from Vietnam. Yes. Unable to function. And according to, his comrade in arms, right, who's supposed to have his back, he's not a real Vietnam vet, because he didn't, go out into the jungles with two other guys.
Yes, so we can't do that. And anyone who wore the uniform, whether you wore it overseas or you wore it here in the United States and never left, CONUS, the continental U.S., you were at risk of being targeted, and being threatened. And
and you served, you could get PTSD and musculoskeletal injuries and drink contaminated water without, as you say, it never leaving the continental U.S. And I think that, unfortunately, we have to have policy being made by people who have sympathy for the visible and invisible wounds. And it doesn't matter where you fought, where you served, if you didn't serve, there other ways of serving your country than going offshore and volunteering to get killed. And so I think that this issue of equity is something that it's both structural and institutional, and it's attitudinal. And I think the VA has certainly got a ways to go, but it's a system that there's an Office of Health Equity, right? How many healthcare? I don't think Sutter or Humana or Tenet has offices of health equity, or if they do, it's kind of really how can we have more inequity?
Right. It's more how can we put better commercials out to get more people to sign up?
Yeah, right. I mean, how can we spend more money to give more unequal care? So, I mean, the VA is a system that, it's a system.
Right. And it's really important to point that out, that the people who are making these decisions about the VA and the funding and all those things, it's really a moral, ethical issue. Even if you were a veteran, you cannot use yourself as the reference point for all veterans. You have to use your moral and ethical guides and your compass to make sure that you're taking care of the people we promised to take care of as a nation.
Exactly.
Yeah.
Yeah, and I think that, I mean, I think that ironically, when I talk to my psychologist friends in the VA, they say that those attitudes, I'm better than him and he didn't serve and he can't understand, that's almost a symptom of mental illness, not a. But I mean, I once had a conversation with somebody in the Legion about, other than honorable discharges, which is really a whole other way that you have, that you embed inequities into the system, because as we know, particularly after Vietnam, African American veterans got these horrible discharges, much more than non, than white veterans.
Counterparts, yeah.
Yeah, and they're punished by not getting any access to health care,
Well, we're running low on time, but I heard a ray of hope because, I woke up with a little bit of depression this morning, but Jasper just infused me with a ray of hope because he said, it looks like some things are changing. So maybe we can talk about some of the good things that are going on. And
Yeah, sure. So, Senator Elizabeth Warren led the charge to get a government accountability office investigation into some of these issues, both around benefits, inequities, and just around sort of cultural issues at some VA facilities. That should be coming out soon. I mean, there's also been a lot of really fantastic advocacy by groups including the Black Veterans Project and Minority Veterans of America, both of which emerged during the Trump administration. I mean, frankly, for a long time, most of the advocacy has been run by groups like the American Legion, which frankly has a past of outright racism. There has never been a black leader of the Legion. But these new groups are dynamic. They are aggressive, and they're really pushing for change within the VA. And Joe Biden's VA Secretary Dennis McDonough has convened a task force with these people to deal with these issues, and they're basically concocting a data-driven approach to assess the issue and then address it. And so hopefully there is some hope that some of these improvements will be made shortly. And also just as the military diversifies, I mean, just like the general population, it'll be, majority minority soon. That will lead, I think, to also just broader cultural change for the better in the military and inside VA.
Right. And, you hit another point, too, that's really important, is that there are, things around equity, equality, and justice, and each of those have a certain meaning, and that we have to make sure that we understand the use of those terms as we're, going and wading through this water. But we're running out of time. Every time, I get the two of you on, I feel like I need to have 3 hours because you have so much information and knowledge. But you have given us a lot of light on this topic of the disparities of Black veterans' care in the VA and health care. And I hear that real strong voice of support for the VA system overall. It's our system, so we have to work with it and hopefully, make changes over time. The military led the nation in the way of integration as well. It did a lot of things that are, contrary to public belief, and all of that is that it didn't really start in the public. It started in the military when we start talking about a lot of the issues that were forced into the equation of equity, justice, and equality. So I want to thank you, American Heroes Group Roundtable with partner Veteran Healthcare Policy Institute, VHPI, Suzanne Gordon, the VHPI Senior Policy Analyst, and also Jasper Craven, the VHPI Interim Executive Director. Both of you walk on water to me. I know it's not Easter yet, but I think the two of you are great, and they're doing some great work for our veterans out there.
Thank you so much, Damon. Thank you.
Okay.
Always.
Sure.
Thank
Okay,
you so much.
stay with us. Stay with us. We're going to be back in one moment.